Thank you. My name is Naomi Valentine and I'm talking today about making it fair, learners and assessors' perspectives of the attributes of fair judgment. In education, there is broad agreement that assessment should be fair. Traditionally, ideas and terms such as objectivity, construct validity and reliability have been central to fairness of assessment. However, assessment has changed. Today's competency-based medical education is at odds with traditional objective measurement-based assessments. As a result, there is an increasing push within the literature to embrace human judgment in assessment and accept its subjective nature. However, in embracing human judgment in assessment, an important question has arisen. What makes human judgment fair? Without insight into this, human judgment will continue to be viewed as too subjective and unfair. There is no simple definition of fairness. However, the underpinnings of fairness are inferred in the literature, and a recent review has brought these inferences together to create a conceptual model. Whilst this is helpful, it is still merely a literature-derived model. It is important to know what the on-the-ground assessors and learners perceive to be fair human judgment. This study aimed to address the following research questions. Firstly, what do assessors and learners perceive to be the characteristics of fair judgment? And secondly, how do these understandings of fair human judgment of assessors and learners compare with the theoretically constructed conceptual model? A thematic analysis approach was used. A purposeful sample of 12 assessors and 8 postgraduate trainees undertook semi-structured interviews using vignettes. Themes were identified using the process of constant comparison. Collection, analysis, and coding of data occurred simultaneously in an iterative manner until saturation was reached. This study supported the literature-derived conceptual model, suggesting fairness is a multidimensional construct with components at individual, system, and environmental levels. At an individual level, a narrative was seen as essential for fair judgment, as narratives allow for learner reflection and improvement through feedback. Furthermore, a narrative also aligns the learner and assessor's perspectives on how the learner is performing. It is the responsibility of the assessor to ensure they have attempted to inform the learner of how they are performing against expectations. Fair judgment decisions are based on evidence which is in or out of scope, or in other words, what is in or out of bounds. These boundaries are fuzzy, but generally, judgment decisions need to be relevant to remain within boundaries. Secondly, to remain fair, judgment decisions must not have a misplaced purpose. That is, where the decision was not made in the best interest of the learner or patients. Fair judgment decisions are supported by evidence. Evidence should be contextual and longitudinal to allow for patterns of performance and triangulation. Evidence should also be comprehensive. Multiple competencies are needed to be a competent clinician, and fair judgment decisions should consider all of these competencies, not just knowledge. Narrative, boundaries, and evidence are all combined by expert and agile assessors. To make fair judgments, assessors need to embrace the complexity of the situation and meaningfully interpret, weigh up, collate, and triangulate pieces of evidence whilst considering the quality and the context of the evidence. They also need to ensure the evidence is within fuzzy boundaries and provide narrative feedback to the learner. Moving now to system factors of fair judgment. Fair judgment allows for multiple assessment opportunities over a period of time to allow for multiple data points to be collected and patterns of performance to be recognised. Furthermore, learners need to also have a time and work opportunity between assessments to respond to narrative feedback given. Using multiple assessors is perceived to contribute to fairness, to enable more data to be collected, allowing for triangulation and a broader range of competencies to be assessed. It also allows for diverging perspectives and group support in making judgment decisions, particularly difficult decisions. And finally, to ensure transparency, all facets of the judgment decision need to be documented. System factors are supported by procedural fairness. Procedural fairness provides transparency of expectations of the learner, ensuring judgments are fit for purpose and ensuring judgments are proportional. Procedural fairness also includes allowing learners to speak and provide their perspective to the situation, assessor self-reflectivity, and ensuring assessors are sufficiently engaged in assessment. Finally, the environment needs to be considered in fair judgment. Judgment decisions are seen as fair if they consider the impact on patient care and the community. Furthermore, fair judgments require a learning environment which allows for learning, considers the learner's individual circumstance, and has a culture of wanting the learner to improve for the sake of patient care and the learner themselves. Finally, the assessment environment must support making difficult judgments early to allow learners opportunities to improve and to avoid unnecessary burdens for the learner themselves, colleagues, and future assessors. So, in a nutshell, defining fair judgment in assessment is complex. However, it can be done. Whilst a simple, universally agreed upon definition of fairness may at first glance appear to be desirable, delving deeper to better understand what the foundations of fair judgment are may allow for a more usable narrative for training institutions to negotiate what fair judgment actually is. This study builds on the theoretically derived conceptual model, demonstrating that the components of fair human judgment can be explicitly articulated while still embracing the complexity and contextual nature of health professions assessment. This model is not to be considered yet another checklist, but rather creating a shared understanding about what fairness of human judgment in assessment is. Having shared understanding can support dialogue between different stakeholders and allow for collective intelligence about how to best negotiate fair judgment in assessment.